Welcome to another episode of the Counselor's Soapbox video channel. Today we're going to talk about preventing drug use disorders. Recently we've seen an increase of focus on prevention of substance use disorders. Some of the reasons for this increase in attention on prevention have been the opioid epidemic and the resulting deaths from it, the spread of infectious diseases, often linked to drug use, such as HIV, AIDS, and hepatitis C. Some of the goals of prevention programs are to stop the spread of diseases, also to stop drug use or stop people from initially beginning to try drugs, and to reduce crime and violence which may be the result of drug use. When we talk about prevention of substance use disorders, it's important to look at what it is we're trying to prevent. There are a number of possible goals of prevention. One would be to prevent first use of a drug. If you never use it in the first place, you can't become addicted to it. We could also attempt to prevent continuing use so that people's problems with drug use do not get worse. We could prevent negative effects on society. Also, an important prevention goal would be to prevent or reduce health problems which people may experience as a result of their drug use. There are also a number of other possible goals. In defining substance use disorder prevention, we need to look at three separate types of prevention programs. Primary prevention aims to attempt to keep substance use or abuse from occurring in the first place, hoping that people will never start to use. You will not have a problem with what is used. Developing responsible attitudes about drug use could also be helpful in preventing first use. Primary prevention programs are often aimed at everyone in the population. A TV commercial might show the negative events that would occur when people use drugs. We don't know that the people who are seeing that commercial have a problem with drugs, but the prevention effort is sent at everyone, whether they have a problem or not. Secondary prevention programs have a more narrow scope. They attempt to intervene when people first are using drugs and prevent problems when they very first appear. They could be a form of early treatment. We see this in school settings where a student is caught with cigarettes or increasingly marijuana or alcohol, and they are required to take some kind of a class in order to stay in school or to be reinstated in school. We don't know that that person has developed a substance use disorder, but since there are some indications that they're doing drugs, we want to make sure that we prevent it from turning into an addiction. Tertiary or third type of prevention programs includes treatment for those with a substance use disorder to prevent their disorder from getting worse. Our goal of these tertiary prevention problems would be to get them to stop using or to reduce the harm from that use. Examples of these might be court-ordered classes in drug or alcohol use disorders. One of the big questions that prevention programs have to answer is, do their efforts to educate young people really amount to advertising for drugs? Some of the prevention programs have been criticized for talking about so many different drugs that they in fact just create a demand for these drugs, a laundry list of drugs that students might want to try. Programs which work in substance abuse prevention are often divided between two types. Those who spend a lot of time talking about individual drugs and how to resist taking drugs, how to say no, and those programs which emphasize life skills, how to live life without drugs or alcohol. When we talk about prevention initiatives, most people think about programs aimed at children or adolescents. If you can keep the teens from trying drugs in the first place, you might prevent their developing an addiction. But there are a number of other prevention initiatives which try to reduce the harm drug use causes society. One are things like social host ordinances. In those, parents who allow children to consume alcohol or other drugs on their property can be fined. Worksite prevention programs are also another example. Many employers find that drug use and alcohol use can cause significant problems with employees missing work and lost productivity. It costs a lot to hire and train an employee, and providing some kind of employee assistance program to reduce the problems of substance use can be much more cost effective than firing someone and hiring a new employee. Another example of a prevention initiative is college drinking norms. Many incoming freshmen at college believe that everyone in college drinks heavily. The truth is that the heavy drinkers are confined to a very small percentage of the students. Surveys have shown that the average student at most colleges consumes a lot less alcohol than other students think they're consuming. Telling students how much the average student at their college consumes can help to lower the average consumption. Other forms of harm reduction can include things like legalization, by making marijuana, for example, legal for recreational use. We've eliminated a lot of people being arrested and spending time in jail, and a lot of resources spent in that area. However, it remains to be seen if other problems will develop as more people use more marijuana. In some countries, they have safe injection sites in which users, for example, heroin users, can go to their doctor, get a needle and a prescription dose of an opiate, go into a little room, inject themselves, and dispose of the needle. This prevents them having to do illegal activities to get drugs, and it prevents contaminated needles from being all over the street. Some programs for the mentally ill have included things like wet houses. Often public housing is not allowed drinking, and that has been a barrier to getting people off the streets and into public housing. In the wet house, people are allowed to consume alcohol as long as they do it in their rooms and are not a problem to others. And a very common form of prevention in the United States is methadone maintenance programs. By allowing people to get a measured dose of methadone each day, the desire is to create a reduced need for them to get illegal drugs on the street, and they don't need to do crime in order to find the money to pay for their drugs. Drug prevention programs frequently use one of three models for their program, though these can be combined in multiple fashion. One is the socio-cultural model, which says that you educate people about what is acceptable drinking or drug use, what's unacceptable drinking or drug use. For example, drinking with meals would be considered okay. And so by teaching people what your culture or society says is acceptable or not acceptable for drug or alcohol use, you reduce unacceptable behavior. Another effort is to disrupt consumption. The idea here is that the heavy drinkers or heavy users of drugs will probably continue no matter what you do. And so the light users will also occasionally try it. But it's the people in the middle, the moderate users. So as the average consumption increases, so does the number of heavy drinkers or drug users. Reducing average consumption can reduce the number of people who use or drink so heavily that they get into problems. So that you make the consumption more difficult, raise the minimum age, increase the price through taxes, or reduce the hours of sale. This reduces the number of people who will consume drugs or alcohol excessively. And then the last model of prevention is what's called the prescriptive model, where you tell people, don't do it. If you can convince people of this, no use, no problem. We also sometimes imply from this that there's something wrong with people who use or something wrong with people who go on to become alcoholics and addicts. We tried some of this prescriptive model during Prohibition and with Just Say No programs. Generally, these have not been effective. One of the challenges here is that humans inherently seem to want to try out new and risky behaviors. A great many people experiment with alcohol, tobacco, and other drugs during their teenage or early 20 years. What we want to do in prevention programs is try to keep those experimentations from becoming life-threatening or lifelong addictions. Thanks for watching another Counselor Soapbox video. What's ahead? More drug education videos, many about specific drugs. Also, some mental health and wellness videos. If you've enjoyed this video, please click the like button, which is directly below this. Comments are always appreciated. And to receive new videos in this series, please subscribe to the Counselor Soapbox video channel. Thanks for watching the Counselor Soapbox video channel. For more information on this and related issues, please visit the Counselorssoapbox.com blog, where you'll find over 1,500 texts, articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are now available on a wide variety of ebook sellers platforms. The photos here are all courtesy of Pixabay and Wikimedia and are licensed under the CCO Creative Commons free for commercial use, no attribution required license. Thanks again for watching.